Have you ever looked at your dog and noticed something feels different? Maybe they're sleeping more, eating less, or choosing a quiet corner they never cared about before. You tell yourself, they're just getting older. And sometimes, that's exactly what it is. But sometimes, these changes can be signs that something more serious is happening. Today, we're looking at 10 heartbreaking signs that may appear when a dog's health is declining, and what each one could mean. Because recognizing these changes isn't about assuming the worst. It's about noticing when your dog may need more comfort, more attention, or a conversation with your veterinarian. And stay until the end, because the 10th sign is one many owners remember most. First is, they start seeking unusual quiet places. Has your dog suddenly started spending more time under the bed, in a corner, on the bathroom floor, or somewhere they normally never choose? A change like this can be easy to dismiss. But when an older or unwell dog suddenly begins seeking isolation, it may be their way of responding to discomfort, fatigue, or simply needing more rest. It doesn't necessarily mean they're rejecting you. Sometimes, their body is simply asking for less stimulation. So instead of forcing them back into their usual spot, go to them, sit nearby, speak softly, and let them decide how much interaction they want. Because when your dog's behavior changes, the most important question isn't, why are they avoiding me? It's, what are they trying to tell me? Second is their appetite suddenly changes. One of the clearest changes you may notice is what happens at mealtime. A dog who normally runs to their bowl may suddenly lose interest in food. They may eat only a few bites, leave their favorite treats untouched, or stop showing excitement when you prepare their meal. For an older dog, a sudden change in appetite can be important. It can happen with pain, illness, dental problems, or other health issues. And it doesn't automatically mean your dog is nearing the end of life. But if the change is sudden, persistent, or happens alongside other symptoms, it's something you shouldn't ignore. Don't force your dog to eat. Instead, keep them comfortable. Offer food your veterinarian recommends, and pay attention to how much they're actually eating and drinking. Because sometimes the smallest change in a routine can be the first clue that your dog needs your help. Third is they lose interest in things they once loved, the toy they used to chase, the walk they couldn't wait for, or the game that always made their tail wag. Suddenly doesn't seem to matter anymore. They may still respond to you, but with less energy than before. This can happen when a dog is experiencing pain, illness, or significant fatigue. It doesn't automatically mean they're saying goodbye, but a noticeable loss of interest is a change worth taking seriously. Don't force them to play. Instead, give them quieter ways to enjoy your time together. A gentle cuddle, a slow sniff outside, or simply sitting beside them. Sometimes, love means changing the way you spend time together. Fourth is they sleep much more than before. Maybe your dog used to follow you around all day, but now they spend most of their time sleeping. Longer naps, less interest in activity, and fewer moments of excitement. Older dogs naturally sleep more, but a sudden or dramatic increase in sleeping, especially when combined with other changes, can signal pain, illness, or declining energy. Don't wake them constantly or force activity. Give them a comfortable place to rest, and watch for changes in their appetite, breathing, movement, and overall behavior. Because sometimes, rest isn't just rest. It's your dog's body asking for more time to recover. Fifth is they struggle to move like they used to. You may notice your dog. taking longer to stand up, hesitating before climbing stairs, or struggling to get comfortable. Maybe their back legs seem weaker, or they no longer jump onto the couch. These changes can happen with aging, but they can also signal pain, arthritis, or other health problems. Don't push them to move more than they comfortably can. Make things easier with non-slip rugs, a comfortable bed, and gentle assistance when needed. Because when your dog's body starts slowing down, your job is to make their world a little easier. Sixth is their breathing changes. You may notice your dog breathing faster while resting, panting when they haven't been active, or struggling to find a comfortable position. A change in breathing can have many causes, including pain, heart problems, lung disease, or other serious conditions. So don't assume it's simply old age. If your dog's breathing suddenly becomes difficult, especially with weakness, blue or pale gums, or obvious distress, contact your veterinarian immediately. Your dog may not be able to tell you they're struggling, but their breathing can speak for them. Seventh is they become more restless. Instead of settling down, your dog may start pacing, changing positions, getting up and lying down repeatedly, or struggling to find a comfortable place to rest. This can be a sign of pain or discomfort, especially when it is new or persistent. Don't assume they're simply being difficult. Give them a quiet, comfortable space. And if the restlessness continues, talk to your veterinarian. Because when your dog can't seem to get comfortable, they may be asking you for help. Eighth is they stop responding the way they used to. Your dog may still look at you, but their reactions seem quieter. They may not greet you at the door, get excited about their favorite toy, or respond as quickly when you call their name. Sometimes this happens because they're tired, in pain, or dealing with changes in hearing, vision, or cognition. It doesn't mean they've stopped loving you. They may simply have less energy to show it. So, stay close, speak gently, and don't demand the same response they gave you years ago. Their love may be quiet now, but that doesn't mean it's gone. Ninth is they become more dependent on you. Some dogs become unusually clingy, following you from room to room, wanting to stay beside you, or becoming unsettled when you leave. This can happen when a dog feels vulnerable, because your presence gives them comfort and security. But sudden clinginess can also have medical or anxiety-related causes. So don't assume it's simply a goodbye. Give them the reassurance they're asking for, and pay attention to what else is changing. Sometimes the dog who suddenly wants you closer may simply be telling you they don't feel like themselves. 10th is they seem to look at you differently. Sometimes it's not a dramatic change. It's simply the way your dog looks at you. Their eyes may seem quieter. They may hold your gaze longer, or they may simply want to sit beside you without asking for anything. On its own, this doesn't mean your dog is saying goodbye. But when this change appears alongside several other signs, it can be a reminder to slow down, pay attention, and make sure they're comfortable. Sit beside them, speak softly, give them the time they need. Because sometimes, the most important thing your dog needs from you is simply your presence. If your dog is showing some of these changes, please don't immediately assume they're saying goodbye. Many of these signs can also happen with treatable medical conditions, pain, or normal aging. The most important thing you can do is notice the changes, look at the bigger picture, and talk to your veterinarian when something feels different. Because your dog can't explain what they're feeling. You have to be their voice. And if their health really is declining, what matters most isn't making every moment perfect. It's making those moments comfortable, peaceful, and filled with love. Stay close, listen to them, and let them know they don't have to face it alone. Because after all the walks, the games, the quiet mornings, and all those ordinary days, your dog has given you something priceless, a lifetime of unconditional love. And sometimes, the greatest gift you can give back is simply being there.